Friends, COVID is practically gone. But all those who had COVID, many of you are presenting to us with very non-specific somatic symptoms, and it is ranging from headache, muscle twitchings, not feeling good, sleeplessness, acidity, cramps, breathlessness, fatiguability, tremendous amount of feeling low. These are all long COVID symptoms. Dear friends, long COVID is a kind of persistent immunological disturbance which happens after COVID and usually happens to those people, those who have a poor mental health, those who are very anxious, those who are thinking very negative about the COVID. So this normally happens when the COVID hits your body. It creates a kind of inflammatory cascade, and many times these inflammatory mechanisms behaves like a little autoimmune. That means this mediators they start affecting your different organs non-specifically. It's a kind of low dose of autoimmune disease. So friends, if you really want to come out of your long COVID symptoms, you have to think positive. You have to take care of your mental health. There are a couple of factors it has been found to be responsible for the long COVID symptoms, and we are getting plenty of these problems in the society. As I mentioned, poor mental health, lack of sleep, lack of physical exercises, metabolic problem in the form of poor control of sugar, elderly people, those who are staying alone, those who are not talking to the people, those who are little disconnected from the society, poor nutrition, all those could be a factor. And of course, low sex hormones. So, dear friends, if you really want to come out of this long COVID scenario, you have to be positive, you have to be physically active, you have to change your diet. You should be taking more frequent meals in the form of high protein, a lot of fresh foods. You have to stay connected. Cognitive behavioral therapy. It's a kind of mental health therapy where the thought changes your behavior and behavior changes your action. The cognitive behavioral therapy we practice at SANS is a very useful tool that takes care of a mental health. Many of the people, those who have a poor emotional health, they need rational emotive behavioral therapy. These are the counseling techniques we are teaching people. Our counselors, our psychologists, and therapists are very equipped to handle these problems. So we can map through our questionnaires whether you have a poor mental health or you have poor emotional health. So all those people, those who have a poor emotional health or a mental health or a poor environmental health, those who have been confined to a space is thinking what will go wrong, always thinking about the future or taking their past into today. So these are the people are going into this kind of disturbances. And usually when you have a poor mental and emotional health, you create a tremendous amount of sympathetic drive, what you call the release of certain, catecholamines or sympathetic hormones, and that increases your heart rate, increase respiratory rate, and you start breathing faster. This is called hyperventilation syndrome, and this is being plenty in the society. And when you are hyperventilating, when you have an anxiety, what you get fatigue, your work of breathing increases, and at the end of the day, you feel very listless and drained out. So, friends, long COVID is not a big thing. Only thing you have to stay positive. You have to do affirmation. You have to think positive. If you're not able to cope up with your mental and emotional health, you have to talk to your therapist and psychologist. You can come to us. We can help you out. You need high calcium in your food, right kind of nutrition. You need a specific nutrients in your diet, good high intensity repetitive exercises, muscular relaxation. And another very important thing is that in COVID, what happens because you're confined to your space, many times you have these vestibular disturbances, the balancing system, what you call the disturbances of autonomic functions. So you need to do certain vestibular balancing techniques like Pilates and certain yogic techniques like Anulam Vilom, and certain yoga also helps you. So dear friends, you need a structured holistic program. You need some wellness programs. You need a very structured 360-degree approach, what we are doing at SANS. All those patients who are having long COVID symptoms, we take them for a 360-degree drive from physical, mental, emotional, environmental, social to a spiritual journey. And we help them, we skill them, and really these patients are doing well. What you need is you have to stay connected. You need some coaching. You need to skill yourself. And otherwise, this long COVID can behave like a chronic fatigue syndrome. It can go on and on. So, friends, not to worry. If you have all these symptoms, you can contact us. We'll love to help you out. Regards, Dr. Bose, founder of Sans Foundation.